hand versus chainsaw. It looks painful.
Our hospitals are taking care of more patients than ever.
You're right.
With medical teams under constant pressure.
Can Dr. Pixie come to resource, please?
Somebody as poorly as this little one, we really need to treat them quickly.
To meet our expectations.
I'm just worried about what it's going to be like afterwards.
But there's a crucial member of the team we sometimes forget.
I've never ever been on a bed like this.
The hospital bed.
Another ward, another story, another bed.
In our lifetime, we are likely to need one of them at least 3 times.
I've probably spent a quarter of my life on a hospital bed.
In this series, our cameras have been given unprecedented access to beds in 4 very different hospitals across the country.
It's life and death and everything that goes in between.
We'll see the world through the bed's eyes.
Hello, my love. Hiya.
As they share the most challenging,
I don't know what to do. I don't know.
most intimate, and most rewarding
Happy birthday. In hospital, wonderful.
moments of our lives.
Thank you for being here.
Have you been anywhere else?
And a hospital cannot function without beds. Beds are vital.
This is the secret life of the hospital bed. In Britain, people are living much longer than they were 2 decades ago, thanks in part to medical advances.
Bed 43 and we'll be going home in about 20 minutes if we still need the bed.
Yes, I do, yeah.
Okay. Yeah.
And every week at Birmingham's Queen Elizabeth Hospital, doctors perform life-saving procedures.
Okay there, Lisa. Doing very well.
These treatments happen on their day surgery unit. There are more than 80 beds here which look after patients before,
Have you had any heart attacks in the past?
No.
during,
Just take a big breath in for me, so hold it.
and after their operation.
Thank you ever so much, Chick. You're a star.
Day surgery bed 8 is ready for its first patient.
Sit on the bed.
Today, 75-year-old Shirley is having a stent inserted into a blocked artery.
So I'm just going to pop your allergy wristband on, Shirley.
Without this intervention, she's at risk of having a heart attack.
All right, just span your wristband.
Shirley became widowed when her children were young. She's never remarried. Her support today is her son's partner, Jenny.
I started going out with Shirley's son Adrian about 11 years ago, so I've known Shirley 11 years. We get on really well, don't we?
We do. We just call each other sisters, don't we?
Yeah, we do. One time, Shirley came with us to Amsterdam, to the Tulip Festival, which was absolutely gorgeous, wasn't it? But we were a little bit surprised when we was walking down one of the streets of the evening, what was in the windows down the streets, didn't we? It was a bit of a shock.
Twilight area. Yeah, I couldn't understand why all these women were sitting in the window with a light behind them, with their clothes on. It's the way they...
But Shirley took it all in a stride.
Yeah, I just thought it was quite great, actually. I found it quite amusing, I'm quite broad-minded, aren't I?
Shirley will be one of 75,000 people who have a stent fitted each year. She had a heart attack 10 years ago. This will be her 3rd stent.
Well, I had 2 the first time, and the second time I had to have a repair. One of them wasn't working properly because they got filling up of the arteries, which is making me very breathless, and I've been having some dizzy turns and that, so.
Cardiologist Dr. Khan prepares Shirley for the procedure.
So Shirley, how have you been over the last few weeks then? Have the medications been helpful?
Well, I did have an angina attack yesterday.
Oh, really?
And that was when I got my arms up, putting the washing on the line.
I can understand that.
And then I took
so
the
all
spray.
all the reason to do the procedure then?
Yeah.
There are serious risks associated with this operation.
I hope you understand the bit of complications which can occur, the major ones.
Yeah.
So there's 1 in 200 risk of having a stroke or a heart attack
Yeah.
during the procedure, or in extreme case scenario, there can be, God forbid, death as well.
Yeah.
So these complications can occur. We try our level best that they don't happen, and if they do happen, God forbid, we try to level best to manage it as well. Okay?
Yeah.
So, and hope everything goes fine.
Yes, okay. Thank you very much, Doctor. Thank you. And of course, I'm more at risk now because I'm older, and also my blood's thinner now than it was before. So it's just that risk. But what can I do? I've got to have it done.
The thing is, you want your quality of life back,
Yeah.
and this is the way that you can get it.
Yeah. It's a cup of tea I'm looking forward to. Got something to eat. I've had nothing to eat since 6 o'clock.
Day surgery bed 8 takes Shirley for her life-saving procedure.
I'll see you in a bit.
Okay, love. Okay.
See you in a bit. Enjoy your lunch bed when it's over. Waited a long time, but it'll soon be over.
Every year, around 10 million visits to A&E involve having an X-ray.
Breathe in
You're breathing in.
and out. And just hold your breath. That's it.
At the Great North Children's Hospital in Newcastle, more than 50 patients a week arrive at the paediatric A&E with a suspected fracture.
And then we'll get you round to X-ray and get some pictures taken. You all right?
The emergency department has 9 beds. They're used to looking after patients from toddlers to teenagers who may have broken a bone.
Hello, PJD, Becky speaking.
Paediatric bed 27 is being prepped, ready for its next child. Today, 4-year-old Rebecca has been brought in with a suspected broken arm after falling over in the playground.
I fell off in school when I was done nursery.
Her mum, Num Pung, works in a care home and her dad, Nicholas, is semi-retired.
I went to pick Rebecca up from school at 1 o'clock, and when I got to the school, she was crying, and I had a look at her, and she was holding her right arm and not moving it. And when I compared it to her left arm, it looked as if it was very swollen around the elbow.
Nurse practitioner Rutherford begins the assessment.
My name's Lynn.
Hello,
The
Lynn.
nurse practitioners.
Nice to meet you.
Rebecca, are you able to tell me what's happened?
My arms is broken.
Your arm's broken, is it?
This arm.
Oh, how did you break your arm?
Because I fell over.
Right, can I have a little look at your arm? Yeah. Have a little look at your fingers first. Can you wiggle your fingers like that? Yeah?
It's just tickle.
It tickles,
Tickles,
does it?
does it?
All right.
Oh, she's a tickly girl.
Now I'm going to have a little feel of your arm. You tell me if it hurts when I press.
Is that?
Does it hurt there? Okay. Was it really sore over here? Yeah. You're very brave. Aren't you? Yeah. Can you bend your arm?
Try,
Can we try a little bit?
Try a little
bit. Will it only go that far? That's all right. Okay. And if you may tickle your arm down here.
Tickle.
And if you may tickle your arm down here. Yeah, you can't you? So, do you think we should send you for a picture of your arm? And see if you've broken it? And see having to go to school if you've broken your arm. After you've just started.
Unfortunately, she's got her first dance class tomorrow. She's been talking about it for weeks. I'm not sure she's going to be able to go with her arm.
Stickers. I've got special princess ones. Which ones do you like?
The blue castle.
The blue castle. Should we put the blue castle on? Where do you want that one? There you are.
What do you say?
Thank you.
You're welcome.
Come on, young lady. Should we take you around the corner and get some pictures took here, eh? And go for a drive?
Look at this, you've got a bed that moves.
Magic
Look at that.
Paediatric bed 27 takes Rebecca to have an X-ray on her arm. She'll soon discover if it's broken, which would mean the dance class will have to wait. Across the UK, patients attending all A&E departments should be seen, treated and moved on in under 4 hours.
Thank you, bye-bye.
4 hours actually isn't very long. It's quite a short period of time, but it's much better for the patient. So I personally think it's quite a good thing.
At Newcastle's Royal Victoria Infirmary, this pressure is constant.
She's not ready to go yet. She hasn't had any antibiotics.
He's too sick.
There are 29 A&E beds that attempt to reach this target every day.
Hello. Hi, my name's Helen. I'm one of the doctors. Hiya.
It's 11:30 a.m. and A&E bed 9 is busy with a patient. Waiting for it to become free is 76-year-old Tony and his wife Jill.
I quite accept that there's a long wait, so I always bring something to drink, something to eat, and I always bring a tablet where I can play some games and a book I can read, and lots we can do together.
Tony had a fall and came to A&E last week.
He came in and they patched him up beautifully, but he's had ongoing terrible pain in the ribs and the back, which is not helped at all by the medication that he's taking.
Jill and Tony met in 1958.
I remember very distinctly looking straight into the window of the caravan and seeing her there and saying to myself, that's mine. There's no argument about this one. This is it.
2 hours after arriving, bed 9 is ready for Tony.
You want him to get onto the bed?
Yeah, if that's okay. I'll see if it'll go any lower.
I was going to say, will it go a bit lower?
Dr. Moore will be carrying out the assessment. Tony has a history of medical issues, such as osteoporosis and heart disease.
What's been going on to bring you here today?
I fell 2 days... Tuesday last week.
In the street.
In the street.
The ambulance brought you in, darling, and they did an X-ray. They wanted to see that his teeth hadn't gone into the wrong part. He broke the front teeth like that.
Oh dear.
During the night and the day yesterday, screaming with pain.
He's already had morphine, a pain reliever. But taking too much of it can lead to hallucinations and could be the reason for Tony's fall.
With all the morphine, there's been this effect of almost
hallucinations,
and really
scared, terrifying,
serious stuff.
It's quite scary.
It's very scary.
Especially in older age groups, people are on lots of different medications, have different conditions that can have different effects on different things. So it's trying to decide which one of those problems is actually causing the symptoms that he's experiencing.
When Tony came to A&E last week after his fall, he had no pain in his ribs. That has changed.
Let's have a little look at you then. So whereabouts is the pain at the moment?
In here.
Yeah.
Across there.
And around into your back as well?
Across there, yeah.
Okay. Are you alright getting your top bits off for me then? And we'll have a little look.
I might need a bit of help.
Yeah, that's fine.
Did you just undo the button because it will make it easier to get over your head?
Let me just have a little feel around, okay? That's all there.
Yeah. Oh, no.
Sorry. So we're quite tender around these bits.
Tony's osteoporosis makes his bones brittle and more likely to break. He's heading to X-ray on A&E bed 9 to see if he's fractured his ribs. Back in Birmingham, day surgery bed 8 is taking 75-year-old Shirley to theatre to have a stent inserted into an artery. Without this procedure, she could have a heart attack.
Well, I had that.
Nice and gentle. Let me assist with that.
Not too late for you? No. Just keep this with the in the bracket.
Cardiologist Dr. Al Hoos is carrying out Shirley's procedure.
So this lady having ongoing exertional angina, she was investigated by diagnostic coronary angiography a few weeks ago, which showed severe proximal RCA lesion, which we're going to stent today.
A stent is a wire mesh tube that acts like a scaffold to help keep weak or narrow arteries open. This allows the blood to flow freely.
Local anesthetic going in now. Sharp scratch, sharp scratch. If you feel any pain or any pressure, just let me know.
Shirley will be awake throughout the procedure.
You feel more relaxed now? Wait a minute, let me see the correct pressure was.
She's been on the operating table for 50 minutes when there's a complication.
It's still pretty low.
Yeah, can we give her 600?
Her blood pressure has dropped suddenly.
600 micrograms of atropine, fine.
You feel better? Blood pressure went down, the heart slowed down. I think because we gave you lots of sedation, just giving you some medication to improve that.
With Shirley's blood pressure now under control, the procedure can continue.
Take breath and hold it there. Keep holding your breath as long as you can. You're doing great. Speak loud. You may feel some chest tightness while we're inflating the balloon. Now we're going to put stent in it. Making good progress. Everything going absolutely fine.
After an hour and 15 minutes in theatre, the stent is in place.
It was a relatively straightforward PCI procedure. To the right coronary artery with one stent was deployed there.
That's it, that'll do, relax there, okay? I'll sit you up now.
I'm shattered.
Day surgery bed 8 takes Shirley back to the ward.
Hello.
Shirley's son's partner, Jenny, is waiting.
How'd it go? Is it all right?
Yeah.
Was it?
Yeah.
Is it better this time?
Not really. Well, it was a bit better, but it's still traumatic.
Was it?
Yeah.
All over?
Yeah, it's over now, yeah. Good. Want a drink now?
Yeah. Some water.
Oh, I'm just so relieved that it's all over. I'm sure she's relieved that it's all over as well. But it's been a big build-up, but it's all done, and hopefully she'll be much better. It's nothing for me to be here, because, you know, I would hate it if she'd been on her own.
Shirley, I'm just going to transfer you to the bed now.
Shirley leaves day surgery bed 8. She'll recover on a ward overnight.
You're right now?
Yes, I'm fine now.
Would you like a cup of tea?
Yes, please. I'm just hoping I get back into my gardening now.
Oh, absolutely.
Yeah. In a couple of weeks.
Your trips out?
Yeah.
I've got one on.
Pure nectar.
Day surgery bed 8 moves on to its next patient. Back in Newcastle, at the Great North Children's Hospital,
Hello, Peter and A.
bed 27 is taking 4-year-old Rebecca to X-ray.
He thinks these beds are fantastic, these beds with wheels.
They're the best part, aren't they?
She has a suspected broken arm.
Which arm, so? That one. Can I take a few pictures? Just going to pop this side down. Now.
Stay behind the glass.
Turn your hand out just like that.
As Rebecca is so young, Dad Nicholas is allowed to stay with her during the X-ray.
You're ever so dainty. Dad, if you want to hold a hand like that for me. Just like
Like
hold
that?
a hand like, yeah, just like normal.
You all right,
Now
Tim?
shine my light on it.
Oh, look.
Still like a statue. Wonderful.
kept still
Right.
properly.
Perfect. Can I do one more?
Can you turn your arm like that?
Should I get Dad to hold your hand like that? Fabulous.
She's all right. She's got a look on her face, so I think it's sore. They take a photograph of the inside of you, so you can see the bones.
What's your favourite colour?
Purple, red and blue.
And blue. I think I might have a blue sticker, you know.
There you go.
You have another one as well.
Wow, how many stickers have you got?
Oh.
Rebecca may have a broken humerus, a bone in the upper arm. Left untreated, a fracture here could cause nerve damage and impaired circulation.
You're supposed to start your dance class tomorrow, aren't you?
My dance class.
Tomorrow she'll go to school till 1 o'clock and the dance class is at 3 o'clock, so she's got time for her to come home and have a rest. Hopefully she'll get to go for the first day.
So Rebecca has just come back from X-ray. The X-ray is up here on the screen and I can obviously see that she does have a fracture in the bone just above her elbow. She has broken her arm.
Yeah.
So, you were right when you said you'd broken your arm.
She's clever, isn't she? Little girl.
You knew without me even taking a picture, didn't you?
Rebecca will need a temporary cast until she can see an orthopaedic doctor.
What the doctor's gonna do now?
They're going to put a thing on your bad arm.
Wait,
It's a plaster. It keeps it straight like that, yeah?
plaster now?
A plaster, yeah. Not right now, but soon.
You have to wait for the nurse.
I have to wait for your turn. Oh, do you want to cast on that?
Taking care of it is Nurse McGee.
Hello. Hello.
Oh, what's coming?
Put a special plaster on your arm. Touch.
How you feel back?
Good, okay.
Good girl.
She's very brave.
She is very brave. Alright, so this is the messy bit. This is where we get really lucky. Here. Does that feel warm?
She do really well. Very proud of her, yeah. Fantastic girl and always smile, always happy.
Even with a broken arm, she's still happy.
Yeah.
Okay. Tomorrow, Rebecca will be back for further treatment. Missing out on her first dance lesson.
Thank you.
For Bed 27, there are more patients to come. At Birmingham's Queen Elizabeth Hospital, day surgery bed 52 is ready for its next patient. Teenager Sean is having trouble hearing. Today, he's having a tube called a grommet inserted into his left eardrum.
They're going to put me under general anaesthetic, and because I have a very narrow canal, they're just going to put the grommet in, and should be out before the day's over.
Sean has recently turned 19. This is his first time in an adult hospital. He's chosen to come without his parents.
You've gone from being a big fish in a little pond, if you like, to being a little fish in a big pond. So you're no longer a 17-year-old surrounded by 6-year-olds having operations. You're a 19-year-old surrounded by 30 or 40-year-olds having the same operations. So you do get a little nervous, you know. There's always that pressure of adults, you know, being all, you know, stern and whatever. But, you know, it's okay.
He's on day surgery bed 52. Nurses Fulford and Woodward go through the process of admitting Sean.
You've been with us before? Do you want me to take this one? It's probably easier.
You've been with us before?
Not here, no. I've been to the children's hospital, like 27 times, but never here.
There's one too many times there.
I'm actually petrified on the inside,
Let me poke you in the
but
ear.
it'll be alright.
36.9.
They have a few questions for Sean before he goes to theatre.
So you're pretty much fit and well.
I'm okay, I think.
Do you know if your underwear's cotton?
Oh dear, now you're asking. I've not a clue. It's standard, I know that much.
Any jewellery, body piercings?
No. I had to think for a second there.
Any metalwork in your body?
No. I don't think so. This is the trouble with graduating to an adult hospital. You have to know all these things. Whereas you can't just rely on your mom to know them all for you. So.
Transition.
This dressing gown of mine is polyester over cotton. I don't know if that's a problem.
You'll be taking it off anyway.
Okay, that's fine.
This is also Sean's last day before he leaves home for the first time.
Uni tomorrow, that's how I know.
Are you going back to uni tomorrow?
I'm going off to uni, yeah.
Oh my gosh.
First time. All the big events jam-packing together.
Are you going far?
I'm going to Aberystwyth, so as far away from parents as you can get. That's the idea, anyway.
Yeah. Hey. So my name is Mr. Spencer. I'm one of the ENT doctors.
Sean's operation will be performed by ear, nose and throat surgeon Mr. Spencer.
Do you know what you're having done today?
I'm having a grommet in my left ear.
Do you know what that entails?
Not really.
So essentially you've got some fluid behind your drum, so we're going to make a little hole, drain out the fluid and then put a grommet in, which is a bit like a small cylinder, which allows air to get in and out.
Yep.
Okay. I'm going to give you this. This is for
Okay.
you.
Thank you.
And now, just to ensure that we don't do the wrong side, if I could get you to point to the side that we're operating on.
Yep, that one.
So it's the left side here, and I'm going to draw an arrow on your left-hand side. Okay, brilliant. So we'll see you shortly.
See you later. Thank you.
Sean's been on his own for half an hour. Preoperative anxiety is a common reaction experienced by patients who are admitted to hospital for surgery.
Okay, thank you.
Hello, Sean.
You alright?
My name's Paul, one of the theatre staff. We're going to take you down to the theatre now.
Awesome.
A little bit nervous.
I'm petrified.
Okay, are we going upstairs?
No, just to ambulance.
Okay.
Thank you.
Day surgery bed 52 takes Sean to theatre.
There's always a risk something might go wrong. But, you know, it's a fairly minor procedure compared to some of the others, so it should be okay.
Bed 52 will stay with him throughout the operation. In A&E at Newcastle's Royal Victoria Infirmary, the goal is to meet, treat, discharge or admit patients within the national target of 4 hours. After 3 hours in A&E, bed 9 is taking 76-year-old Tony for an X-ray. Doctors think he may have broken his ribs. Tony's wife Jill is with him.
It was amazing last year. He was so well. You recognise now what people mean when they say growing old's not for wimps. It's definitely much harder than you imagined. But we've been very, very blessed with the NHS to turn to. We really have.
You wonder what's next. At my age, I don't expect to get better.
Like Tony, a third of people over 65 fall at least once a year.
Pull yourself forward and pull back. Good. Pull that over your head. Good.
Tony fell over a week ago, but felt no pain in his ribs at the time.
You're doing really well there. Good. Well done, sir. All well done.
Get that board out from behind your back.
A&E bed 9 travels with Tony back to his room, but a more critical patient has now taken his place.
It's got much busier, it seems. So now they've got to find somewhere else.
With the 4-hour A&E target almost up, Tony in bed 9 must wait in the corridor. Dr. Moore has the results.
So basically I've had a look at your x-rays and there's a fracture in your rib on the right hand side down there. So I think what we might need to do is a more detailed scan. We need to see exactly what's going on.
Yes, obviously, yes.
So that's why we'll do those 2 scans. And
Okay.
I think because there's so much going on, it's a bit too much to get done here and get you home in one day.
No, that's fine.
Come in, be thorough, get all of these things
Oh,
done,
I would
and
much
then
prefer that, really.
Is that all right?
No.
Stay overnight so that they can check.
Oh, you're going to keep me in overnight?
Yes.
Then does that sound okay?
Sounds good.
Yeah, and then we get some clear answers for you in a bit.
Thank you.
We're just heading off now.
Okay.
With minutes left before the 4-hour target ends, Tony is discharged from A&E to the observation ward. And a new bed.
How's that?
In A&E, bed 9 is ready for its next patient. At the Great North Children's Hospital, paediatric bed 27 in A&E is standing by for 18-month-old Theo.
Right, yeah, you'll stand there. Okay.
He's fallen and hit his head on the ground. Theo's mum Kirsten and Auntie Leanne fear he may have concussion.
What's brought you in today?
Junior sister Hunt will do an initial assessment of Theo's condition.
He's been at his childminders and he's slipped and he's fallen on gravel in the park.
And where's he hurt so I can see his face?
So he's
Where's
landed,
anywhere?
she said he landed on his forehead, he didn't
Yeah.
put his hands out.
Right.
And then he scraped on his face
Oh,
and he's busted his nose as well.
Oh, mate. And did he cry straight away?
Yeah, she said he cried for quite a while.
Lovely. So no loss of consciousness, not had any behaviour change or
No, he's quite quiet. He's normally a bit more wriggly than
Right.
this, but he's alright. He's had little sleep.
Sister Hunt needs to be sure the fall hasn't caused a serious head injury.
So did he have any bleeding from his mouth or anything
No,
like that?
not that she said. She said it was still bleeding when I got.
Yeah.
That was about 25
Oh,
minutes
mate.
after it happened. But I don't know if it's because he keeps catching it.
Oh.
But I thought there'd be a bigger lump. She thought there'd be a bigger lump.
Yeah. Lovely. I've got your GP's doctor. Well, Wayne Morpeth. Yeah.
Theo's mum was worried.
You'll just be popped in the queue to be seen by one of the doctors or the nurse practitioners.
Yeah.
Okay. But just pop out if you have any concerns in the meantime.
Lovely, thanks very much.
Thank you. See you.
While they wait to see a nurse practitioner, Theo shows signs of improvement.
What are you doing? Which just
doing baby yoga.
But it's pretty good. What do you think, Theo? Are you
Baby
doing
yoga.
baby yoga there?
Baby yoga.
Nice. Oh, nice. Yeah.
I'm a dog.
So when his big brother does yoga, he copies it off the TV. We copy. Yeah. And I think that's what he's been doing today. He's been copying his brother, running about in the park.
Yeah.
And you've just gone too fast for your little legs.
When he first did it, he was a little bit not himself. Now he's perked right up. There's no bump. That's why I was worried.
So Leanne's younger than me by 18 months. I never hurt myself as a child. Leanne was never out of the emergency department. She has stitches in her chin, stitches in her back. She chopped off the end of her little finger in a fire door.
And a car door.
In the car door. And a gate.
Yeah.
And yeah, always a medical file must have been enormous when she was little. Because she used to fall over all the time.
Hello.
Hi.
Nurse practitioner Ramshaw has come to test for concussion.
Has he been his normal self since?
He was a bit groggy when he first did it. Yeah. He had a bit of a nap. He's woken up from his nap, he's realised he's somewhere fun and interesting, and we've perked up a little bit, but he's still quite...
A little bit more subdued than normal.
Yeah, just not as perky.
No, that's a text.
You gonna come here?
If Theo's pupils fail to dilate, that could be a sign of a brain injury.
There, look.
Have a little look and you're beautiful, aren't you?
Say hi.
Just have a little look up this nose.
Theo's eyes are dilating as they should. He's showing no signs of concussion.
Outside of his nose rather than...
If we give him a drink here, and as long as he keeps his drink down, I would be happy for you to go home. Everything looks all intact there. He's moving arms and legs.
Yeah, he's wriggling around.
He is. Singing Baba Black Sheep.
I know.
Some juice? Do you want some juice? I'll leave that with old Auntie Leanne.
Old Auntie Leanne.
Thanks. Say bye.
Say bye.
Bye-bye.
Want some juice?
Oh, is that better?
Right, is that enough? Should we stop?
No. You'll drink it all.
You've literally got nothing left.
Is it all gone?
You've got a tiny bit.
Oh my goodness, you're so heavy.
Theo's had his juice, jumped around on bed 27 and hasn't been sick. He's definitely ready to go home.
On his nose, if there's any problems with it.
I mean, it seems to have stopped bleeding now, which is good.
Yeah, and it didn't look like there was any problems there.
No.
It's all fine.
Yeah.
Any problems at all, just pop them back.
You saying bye?
Make sure.
Bed 27 needs tidying up before it's ready to welcome its next patient. At the Queen Elizabeth Hospital in Birmingham, day surgery bed 52 is taking 19-year-old Sean to theatre. He's having a grommet inserted into his ear to improve his hearing.
Do work hard.
Okay, thank you very much, gents.
It's Sean's first time in an adult hospital. He's chosen to come without his mum and dad.
Please let your hand go. Let your hand go for This one's the one to put your right off to sleep.
Tomorrow will be another first for Sean. He's leaving home to start university.
It's amazing how many people like Freshers Week. You dream about Freshers Week, all right? You have a good time at Aberystwyth.
Okay.
Ear, nose and throat surgeon, Mr. Spencer, will be carrying out the procedure.
The procedure is to remove the fluid, and then we put in a grommet that allows air to circulate inside the middle ear. Mostly done in children, but adults sometimes have the same problem. What happens is fluid builds up in the middle ear, which prevents the drum from moving and vibrating properly, and so they get a hearing loss.
Mr. Spencer completes the operation in just 6 minutes. Bed 52 takes Sean back to the ward to recover from the anaesthetic.
Thank you, guys. Thanks. Press up.
If you need a nurse.
Oh, okay, sorry. All I heard was press. My ears are a little painful, but it's not too bad. I can hear a bit better though, straight away. So that's always good. When I came, it was a lot less scary than what I thought it was going to be.
Today's hospital visit is an important step. Sean's trying to be more independent.
Mum basically helped me out quite a bit, actually. She said she likes to plan everything. She's an obsessive planner. She likes to get everything done. So she liked to know what time I'd be coming back home when you never know. You never know how long the operation's going to take. So she's helped me quite a lot. She made sure I had everything before I came. You know, she'll probably have a meal ready for me when I get home. You know, she's a typical mother. So she helps me out loads. and you don't even notice all the things she does sometimes. I think she wanted me to learn how to do this myself as well. That was quite a key thing, because she's not always going to be there, as you know. You know, I'm off to Wales, so she's not going to be in Wales with me. But she's really helpful. She guides you through it. You know, she tells you what's going to happen. She says there's nothing to worry about, which is always a good one. But whenever someone says that, you always think there is something to worry about. But it turns out there never is.
Sean starts university in Wales tomorrow. He'll be studying history.
It's all about new beginnings. You know, you've got to learn to live on your own, especially if you're in student halls.
It's Nurse Fulford's job to care for Sean.
Try any biscuits or sandwich?
Tempting me here.
You've got to eat before you go.
Whatever you fancy.
Do egg mayo, tuna mayo.
Oh, egg mayo sounds good. You've got to learn to take responsibility for yourself. You've got to learn, you know, the world's not going to be like when you were 6 years old.
Can I help you?
Yes, please. Sorry. Thank you, though. And you feel a lot better if you do something yourself.
As easy as it looks.
Very true. Thank you very much. You always have the reward for yourself as well afterwards, you know.
Sean phones his parents.
Are you okay? Okay. Is Dad coming to pick me up then?
After facing surgery on his own, Sean's dad, James, has arrived to take him home.
Hello.
Today I've been concerned about him, but not as much as his mother. Well, Sean's moving off to uni tomorrow now, and I don't know how we're going to... Well, we'll have to manage without him, but it's only for 3 months at a time.
Bed 52 has ended its shift for the day. Our hospital beds have given us intimate access to the work of the NHS. It took Shirley nearly 2 weeks to recover from her stent operation. She now has a new lease of life. The hospital changed Tony's medication, he's regained confidence walking, and is getting out and about more. Rebecca's broken arm has healed, and she's finally started dance classes. And Sean's Grommet operation has improved his hearing, and he's loving university. The beds are now back on their wards, ready and waiting for their next round of patients.